February is off and running, and this month is American Heart Month. And today specifically, the American Heart Association urges you to go red for women.
Women are more likely to die from stroke than men, according to the AHA, and nearly 45% of females 20 years and older are living with some form of cardiovascular disease. That's sort of the umbrella term for issues that can cause stroke or clogged arteries that lead to a heart attack. So all month long, all Northern Light hospitals in Maine are lit up red, urging people to do more research into their own heart health. I spoke with cardiologist Dr. Craig Brett, who says knowledge is prevention. At what age should you start thinking about heart health?
If you have a family history of heart disease, you have to start thinking about it pretty young, really like beginning of adulthood, because again, some of these genetic cholesterol abnormalities can cause trouble early on. Typically, heart disease is more middle age, 40s, 50s, 60s and beyond, but it's very variable, and really knowing what someone's risk factors are determine when they should really start being more concerned about it.
What are some of those risk factors that maybe we aren't thinking about?
High cholesterol, high blood pressure, smoking, and family history. A big one, particularly here in northern New England, where there's an increased incidence of genetic cholesterol abnormalities people may not know they have, and put them at significant risk for heart disease.
When it comes to women, breast versus heart, breast cancer, cardiovascular disease, which one takes more women? You may be surprised to know the answer.
Yeah, it's a great point, Amanda. You know, people would assume breast cancer or other forms of cancer might be the #1 cause of death in women. No, it's heart disease. In fact, it's higher number of deaths with heart disease than the next 3 forms of cancer.
And women are 50% less likely than men to react quickly when there is an emergency heart situation. Why is that?
Yeah, that's been looked at, and it's really a well-known problem. And I think part of it is that women present a little differently than men. When someone has a heart attack or heart injury, oftentimes the symptoms are chest pain, chest pressure, tightness. Women will still often have that symptom, but they can have other symptoms too that are less typical.
Those symptoms can include discomfort or even pain in one arm or both, or in your back, which could feel like sore muscles, discomfort in your neck or jaw or in your stomach, nausea and lightheadedness.
Every day, almost every day, I see women who are surprised that their symptoms, what they were feeling, was a result of underlying heart disease.
What do you wish that more of your patients would do before they get to this point, before they get to seeing you?
I wish patients knew more about their numbers, what their blood pressure has been, what their cholesterol has been.
And recognize how much chronic stress can impact your cardiovascular health.
It's universal. Everybody's stressed. Things are crazy. I think being very mindful of that, and where someone can control that and be mindful, know that that can help their cardiovascular health. Good prevention, healthy habits, maintaining a healthy weight, being active, that should be lifelong.
We have shared a link to Northern Light's Heart Health page, which includes heart healthy recipes and workouts.